welcome back to the Young Turks. Yeah, we can be calmer than that. All right, we're going to turn to conservative now, so that's fun for everybody. His name is Lee Doran. He's the creator of the YouTube channel, How the World Works. He's also got a job with the Competitive Enterprise Institute, and he runs their activism organization called Bureaucrash. Lee, welcome to the Young Turks.
Thanks for having me on. I appreciate it.
No problem. Now, Lee's made some videos disparaging some of our videos. God bless, it's a free country, and in not so flattering terms, but that's okay. We do a lot of things in non-flattering terms. Lee, I'm going to just ask that the ground rules, as we discussed, is that we keep things, allow each other to answer, allow each other to answer, and not filibuster too much. Okay, so having said that, Lee, first let's find out what the Competitive Enterprise Institute is, so we have a sense of your background.
Well, the Competitive Enterprise Institute is a free market think tank that works on regulatory reforms. What I work at, which I just started about 3 weeks ago, is their activist organization called Bureaucrash. While many of these organizations focus on education and informing the public, Bureaucrash is out in the public as an activist group. We've been working on several of the tea parties. I know that, you've disparaged them, but we've been working on several of those over the last 3 weeks that I've been here.
Okay. Now, who funds Competitive Enterprise Institute?
I'm not, since I just got here, I'm not totally sure who our funders are. It's basically, from what I understand, some private donors, and I'm not sure if, if they're corporations, who they are, because I just got here. I'm not really involved with the donors per se.
Right. Because it would seem to me that corporations would have some incentive to put together a think tank that says corporations rock the world, leave us alone. But,
well, you'd be surprised because, a lot of times corporations like getting handouts from the government. So a lot of them are not, essentially for free markets, which actually is a difficulty that, ironically, many free market think tanks have, is that corporations often aren't, on board because, if the government's willing to take taxpayer money and hand it right over to them, some of them think, why not?
Hey, look, if they were really pushing for the free market and the corporations are not in favor of that, I'd be ecstatic about that. Okay, now, let's bring that over to the healthcare discussion we want to have today.
Sure.
Let's start with the public option. Now, it appears to me that the public option is something that gives the consumer an extra option. You can stick with your private insurance, or you can go with this government-run program. And if the government-run program sucks, it doesn't cover your medical care in the way that you want, or it costs too much, you simply don't go with it. Now, what could be wrong with that? Go ahead.
Well, you and Paul Krugman conceded that it's not a public option. You essentially conceded that it is a government takeover, and the reason why you conceded that is because of your example that you need to have businesses forced to pay for their employees' health care. Otherwise, they will throw their employees at the government to go on to government care, and that will increase the cost. That was what I've been arguing for the last couple of weeks. That's what many people have been arguing over the last couple of weeks, is that you cannot have two options. You cannot use taxpayers' money to buttress a public system that lowers prices below the market because all companies are going to do is throw their employees at it. And it was very strange that you argued that conservatives, therefore, should argue that we should force companies to do it because it would lower cost, and Paul Krugman, I guess, argued the exact same thing. There's nothing conservative, there's nothing free market about first having a forced, government care for your employees.
All right, so let's break that down. You're talking about an employer mandate, right? And
exactly.
Now, the employer mandate is separate from the public option. And
exactly.
Okay.
But you said that you would need it because of the increased cost, and that's exactly what we've been arguing. Is that yes, of course, the second you have two options.
No. Those are two different things. Let me explain. The reason why you need an employer mandate so that costs do not rise is because if the companies say we're not covering our employees anymore, and they say, all right, we're going to let the public option deal with it, right? The problem isn't the public option because you pay premiums for the public option, and if you can afford the public option and you're in an income bracket where you can pay for it yourself, then it makes no difference whether you pay for it or your employer pays for it. But a certain percentage of the people need subsidies, and that's the universal care portion of the package. Now, that's what increases the costs. Yes, that's definitely true. Now, whether you want to have universal care or not is a different question. But it's not the public option that's the problem. It's that if you don't have the employer mandate, the universal care part costs more. You see what I'm saying by that?
But yeah, I do understand what you're saying, but let me break it down and why it doesn't work. Well, first of all, you're assuming that we have enough money to cover this we don't. With the $4 trillion proposed on top of what we have right now, before we even get to this quote-unquote public option, I'll use your words for the moment.
No, but Lee, just let me interrupt for a second. You're not talking about the public option. You're talking about the universal health care, because the public option doesn't cost any money. In fact, according to the Congressional Budget Office, it saves the government $150 billion.
Okay. We cannot, wait, let me just break that down what you just said. We can't afford Medicare and Medicaid as it is. What you're essentially arguing is that we're then going to apply the same principles of Medicare and Medicaid to the entire population at large, and somehow we're going to save money doing that. They just have to cash for
because part of the reason that Medicare and Medicaid costs a lot of money is because it has the same thing as universal health care, which is subsidies for people who can't afford it. That's what costs a lot of money. The public option is all it is another option for insurance. You can call it a different name. You can give it like the ABC Corporation option, right? In this case, the corporation in that example is the government. But you have to pay premiums into it. So it's revenue neutral in that sense, but we think because it's going to have lower costs than private insurance, that's why it would save $150 billion. So your argument is against universal health care. It's not against the public option.
Well, no, it still is against the public option because as it's defined, the public option cannot last. Essentially,
Why?
Because everybody would eventually move over to the public option. You made the statement that insurance companies don't want to compete with that. Well, you can't. You cannot compete with taking tax dollars to buttress a program and then say, look, it's competition.
No, but that's the important part. If I thought it did what you're saying, then I would be against it too. It doesn't take any subsidies. The public option portion of this does not take any subsidies from the government. If it does, then it's an uneven playing field, and you don't really have free market competition. Then, yes, that would be unfair. But the Republicans have, and conservative Democrats have rightfully said in that case, no, you cannot put government subsidies into it, and the Democrats have agreed. There are no extra subsidies. What pays for the public option is our premiums. Just like we pay a premium to private insurance, we'd be paying a premium for public insurance.
Okay, well, then what you're describing is not exactly what's being proposed.
It is.
Well, then I think we have to narrow this out then of what exactly you're supporting. Then you're supporting essentially we're paying the premiums for this public option. What is public about it then?
The fact that the government offers it. So let me break that down. It's a good question. When the government offers it, they say, look, unlike private insurance, we're not going to discriminate against anybody. And I know why private insurance, quote-unquote, discriminates. It's not based on race, but based on, for example, pre-existing conditions. Because they want to make more money. And they say, hey, look, if I know you have cancer, that's going to cost me more money. I don't want to sign you up. It's a perfectly logical business incentive, right, and a business decision for them to make. The government's saying we're not going to do that. So that actually increases the cost of the premiums you'd have to pay for the public option a little bit. But on the other hand, they don't have to make 10 to 30% profit. They don't have to do marketing. And as the government, they have leverage over healthcare providers, and they can lower costs that way. So when you take all that into account, the public option saves the consumer money and eventually also saves the government money.
Okay, but this is I think where the distinction is. You're using the phrase costs when you're really talking about prices, and there's a major difference. You're essentially arguing that we could change the temperature outside by changing around the numbers on a thermostat.
Why is that?
Because when the government says we're going to lower the price of something, that's not really lowering the actual cost. The costs are still inherent in whatever manpower, whatever labor, or whatever is required to produce the pharmaceuticals
Yes.
or the medical treatment. And for the government just saying, look, we're going to lower the cost, how do they do that? They just drop the price,
No,
and then you have shortages.
No, that's not how they do it. And if they do it, they're going to run into a lot of problems. So let me explain. But it's a good and fair point. Look, here's how it works. If you say to a doctor, for example, do this procedure for, let's keep it simple, $100, and he says, look, it cost me $110. I can't do that. You're saying that's the government artificially putting a $100 cap on it. That's fine, but it's not going to work. You're right. That's why there's still private insurance. And if they do that, well, the doctors will say, well, I'm not going to sign on to this public insurance plan. And then people will say, well, if my doctor's not part of it, then I don't want to sign on to it. And they'll go with private insurance. And the public option will fail. The government is not doing that. They're saying we're going to be able to lower costs, not artificially, but because we're not taking a 10 to 30% profit. We're not putting in extra money for marketing. Now, if we set the prices too low, then it'll fail. But we think we can set them low enough that the consumer wins, but at the same time, the healthcare providers will sign on to it. Because if they don't, we can't have a workable option.
I'm just amazed that you don't see the disaster coming from this. I mean, essentially, it's going to cost much more than what they're proposing, and not only that, you're going to have the issue. I mean, in order to cap the cost, you're going to have to do the employee mandate. Basically force the companies to pay for their employees, like you suggested.
Lee, once again, you're confusing the public option with universal health care. If you do the employer mandate, if you don't do the employer mandate, people are going to rush over to the universal health care part, and they're going to need subsidies for it. And that's what costs a lot of money. Now, look, if you want to talk about that portion of it, that's an interesting, legitimate debate, too. And so you say, hey, look, that'll cost a lot of money, and it will. Nobody should be fooled into thinking that, oh, it's going to be free, it's not going to cost that much money. That's what costs the $1 trillion or so that the Congressional Budget Office is talking about here. Now, the question is, and how do you raise money for that? Now, they've got a couple of different proposals. One of them is to raise $540 billion, which is a lot of money, by raising the highest tax bracket by 1.2%. Now, I can live with that. Now, I'm not in the highest tax bracket, so it's easy for me to say, and there are some downsides to it, but overall, when you ask people in surveys, nearly 80% say yes, they can live with that kind of compromise.
Well, I'm sure that 80% of the people are very willing to use other people's money to pay their bills. The problem with that is that you cannot economically just tax one portion of the population and not expect it to harm everyone else. So that those people at the quote-unquote top 1% or whatever you're saying, or you're just taxing the top, you can just make up whatever number it is. They employ people, and they make money because they provide goods and services that people want for a variety of other things. And this idea that you can just, there's an endless amount of money at the top and we can just keep taking it from them, eventually a lot of them are just going to take longer vacations and they're not going to work as long. But let me get to the fundamental issue of how do we solve this health care problem. That we have, I'll take your number arguendo for the sake of argument that we have, we can always go through it. I believe it's around 15% are uninsured. I think you said about 50. Let me say it's 50 for just the sake of argument. The question is how do we insure that 50 million? And you argue that we should have a public plan. The fact of the matter is that most of what the government does increase the cost of pharmaceutical care and increase the cost of insurance for individuals who want to buy not with their employer. Most people who are most people who have insurance by their employer are very happy with their care. Now, the first thing that we could do is this. The FDA is extremely expensive for approving drugs, extremely expensive, and they have veto power over the drugs, which costs even more. One thing that we could do is remove the veto power for the FDA. We can say, look, you have a warning label on drugs that are approved that are not approved by the FDA. If doctors are only going to allow FDA-approved drugs, it's not going to affect them. But it will lower the cost of pharmaceuticals for everyone in America if we just do that. And we also allow people in between the states to shop for insurance. That would lower the cost in of itself. And the third thing that we could do is remove the perverse incentive to have everyone buy insurance through their employer, which is the deduction through the employer, and then instead give credits to individuals for individuals to shop for the best care and create a larger market that would lower the cost.
All right,
that
Lee,
would be a completely free market solution.
Lee, we're out of time here, so let me, as quickly as I can, address all three of the points that I think you made. First, if you say, hey, if you just keep taking from the rich, it sounds easy, but at the end it has harmful consequences. I agree with you. The question is how much, right? If you say, hey, let's bring the tax rate back up to where it was before Ronald Reagan came in, 70% for the highest tax bracket, that to me sounds like way too much. If you say I take the highest 1.2% of earners in the country, and I misstated that, I meant to say it's 1.2% of the highest earners, and you tax them an extra 1 to 2%, then that's not, and they're nowhere near 70%. At that point, they're still nowhere near 50%. I said, well, then that's a different equation. If it's going to cover 50 million people to tax those guys 1 to 2%, I can live with that. Now, if you get it to 5 or 10%, then maybe I can't live with it. So it's a matter of bounds of reason and where you draw those lines. I think
Cenk, I don't want to interrupt, but I'll make it real quick. The thing is, you got to tack on all the other taxes, and they also, when Reagan got in, they removed the loopholes for a lot of people. So it's a little misleading to say that 70% when there were loopholes that could bring people down to around 20 as it is right now.
Lee, we got to take it one by one. So if on another issue you say, hey, you know what? Now we've gotten to the point where it's at the breaking point, and we've taxed the rich too much. I'm willing to listen to that argument, but I don't think we're there now. And you can't just say, hey, we should never tax the rich a little extra for any purpose. You got to look at it case by case, and I think in this case it makes perfect sense. Now, if you say, hey, look, one of the ways to address health care is take some of the FDA regulations away, I'd encourage you to get your Republican senators to try to do that, I don't think the American people are going to be in favor of, say, loosening some of the regulation that the FDA has. I mean, with the mad cow disease, et cetera, I think the problem might be that we have too little regulation in our foods and our drugs.
If I may interject that real quick, I know you said you're running out of time, but essentially, if you remember beta blockers saved about 8,000 lives per year. It was delayed for 10 years. That's 80,000 people's lives that would have been saved had the drugs been allowed on the market originally.
Lee, if you break it down case by case, if you say, hey, the FDA screwed up a little on this one or a lot on this one took too long, I understand the downsides of it. But if we have a system where the government is not sanctioning drugs, do you know how many crazy drugs are going to be on the market and how many people are going to be hoodwinked into taking them and destroying their health care? It's a balancing act, and
you would say,
and I would take the FDA balancing act any day. I think the FDA definitely saves more lives. Finally, and we really got to go here, but 119% is the number that health care insurance, private insurance, has gone up just since 1999. Now, if you tell me that private insurance is working, it's not. Our rates have gone through the roof. We've got to try something new. That's why the public option is just an option. I'd like to try it and see if it works.
Okay. Well, it has gone up because of the perverse incentives that the government created with the deductions through businesses. And so I appreciate you having me on and to discuss this. You know, if you want to have me on again, I'd love to discuss it more. But
all right. I appreciate that, Lee, and I appreciate you coming on. I'll give you the last word on it. And, of course, you can check out Lee's work at How the World Works on YouTube, and he's also with the Competitive Enterprise Institute. We'll be right back. Young Turks.
Thank you, Jack.